Nelson, I mean, it's not... I know we're picking on Jezza tonight, but it's not just Jeremy Vine. I see it all over Twitter. People are saying the mask should be back. Bev Turner, you know, one of our great friends at GBNews, she was saying earlier she was at the supermarket, everyone was wearing a mask again. Why, Nigel? This is mad.
Well, COVID hasn't gone away.
Neither's the seasonal flu, and we didn't lock people up. We didn't wear masks.
Well,
we didn't shield.
Well, if you look at the last World Health Organization figures, we
can't trust them.
313 deaths in this country in the week ending last Monday. So it's still here. We've lost 180,000 people to it. 148,000 of those had COVID as an underlying cause. I agree with all of you. We don't need to have masks. We don't need social distancing. We don't need to shield or anything like that now. We have
now,
to...
no, ever.
Now?
Hang on.
Ever.
What if a new variant turned up?
Doesn't matter. But I have to keep using these numbers.
If it was a killer...
You keep saying 150,000 people died of COVID as the main cause. That is not correct. 150,000 people died with COVID on their death certificate.
No, 180,000 people died. No,
a lot of them had comorbidities, and a lot of people were not even inspected by the coroners. I've talked to funeral directors, I've talked to people in hospitals, right, as part of my priesthood training. A lot of these people were leaving the hospitals in black bags, going to the mortuaries, not inspected as they usually were, not checked, just put down as COVID. A lot of them were.
40,000 of those 180,000 is absolutely right, that they had other illnesses that may well have killed them and they just had COVID on the death certificate. Where it was an underlying cause, which means the main cause of death, that's your 148,000.
Absolutely incorrect.
Well, those are the figures, those are the official government figures.
No, Nigel Farage broke these figures down on this channel, and that is not correct at all. It's not appropriate to keep showing.
They are the official government figures,
all that is
what I'm telling you.
ONS doesn't say that 148,000 people died of COVID as the main cause.
They say it was the underlying cause. So, therefore, that becomes the main cause of death. You're absolutely right. The rest of them had COVID on the death certificate, and they had other illnesses, and it may well be another one killed them, pneumonia or something like that. But when it comes down to the main cause, the underlying cause, that was the 148,000.
It's interesting, Calvin, when you try and speak about the real numbers, the entire establishment comes and gets on your back and tries to shut you down because they are motivated, Calvin, to prove that all of these people died of COVID because they have to justify why they locked the country down.
Otherwise they sunk the economy for no reason.
Yeah. And not just sunk the economy, sunk loads of people's lives. I mean...
But what would have happened if we hadn't done that? In the early days...
You know what?
We hadn't locked the economy
it would have been absolutely brilliant because we would have got natural immunity far quicker. We wouldn't have ruined kids' lives. Those kids who were locked up at their homes would have got the virus, and that's absolutely fine because that's how you develop natural immunity. And what's so fascinating, of course, is that, you know, all of these idiots now admit that Omicron is the best possible natural vaccine, and we could have actually had that much earlier.
How many people have compromised immune systems now from taking 3 or 4 vaccinations?
Yeah. Well, and by the way, we have no idea of the deaths that are going to come from lockdowns and also the vaccines as well.
But 3 vaccines and get Omicron and you should be all right, provided there's no new variant. That's the point.
No, just get Omicron and you should be all right. That's the point.
Natural immunity is the best sort of immunity.
If we had not had the vaccine, we'd have been in severe trouble and there'd been far more deaths.
That's such rubbish. These people that say, I've caught COVID, thank goodness I took 3 injections, otherwise...
But you are talking 15 million deaths worldwide.
How do you know it would have been much worse if you caught COVID without the vaccine? Because I didn't take the vaccine, I caught COVID and I was fine.
Some people were fine.
Indeed, and some people...
But at the height of...
Hyperbole that is...
But at the height of COVID, we had several thousand people dying a day in hospital. That's what was happening in the days when we didn't have the vaccine.
Absolute fear-mongering.
And that's why lockdown worked.
Lockdown worked? Oh, come on, Nigel, come on now.
Lockdown did work.
Lockdown did work if you mean it killed the economy. Lockdown did work if you meant lots of people did not get diagnosed with cancer. And also, if you look at the graph, that
other illnesses, lockdown
it was the only thing.
It was the only thing that worked because
were isolated and lonely and didn't get to see their loved ones. Of course it worked.
When you looked at the graph, that when you had lockdown, that's when cases dipped hugely.
No, lots of the graphs actually lockdown and the cases went up.
Lockdown is the biggest public policy mistake in modern history. And if you go back and you look at what Patrick Vallance said right at the very start, if we lock the country down, this was in March, it's on the record, he said it on the BBC, if we lock the country down now in March and we suppress the virus in March 2020, you know what we're going to get? We're going to get a massive second wave that is going to take out thousands of people in the winter of 2020 into 2021. We did lock the country down and we did get that massive waves of deaths. If we had followed the Swedish strategy, we would have had far fewer deaths from lockdown. We would have had far more natural immunity in the population, and we would have had a far better chance in that winter of 2020 and 2021 to deal with it, because you know what? We didn't have the natural immunity that we needed by that point.
But that was the same Patrick Vallance who said there would be 20,000 deaths. That would be a good result.